Dental implants have been made available to patients that are looking for a permanent artificial tooth replacement solution that will open new doors for them.
So typically the person who's a candidate for dental implants is somebody who's missing teeth and needs to replace them in one way or another. And that can be single teeth and it can be multiple teeth. And they're kind of different animals in the sense that somebody who's lost a tooth secondary to decay, or they've fractured the tooth, or some people just are born without certain teeth that are missing, can be replaced with a dental implant.
Patients that desire the ability to eat and smile like they once did before have selected dental implants as a new sense of confidence for a lifetime of dental success.
What an implant is a cylinder made out of titanium. These days they have threads on them, so they do look a little like a screw. The whole point of those threads is it increases the surface area that bone has to fuse to the side of the implant. We've been using that style of implant, by that I mean a cylinder, since about 1968, and they've just gotten better and better and better and better, and just lots of research behind them. These days, in your average patient, they have somewhere between a 95 and 98% success rate, depending on the study you read. My point to all this is they have a long track record and they work really well. They've got a very, very high predictability.
Implants from our office can replace teeth, support an existing bridge, or even support your existing dentures for a new feeling of satisfaction. In addition to that, these implants do not rely on your neighboring teeth for support. In order for these dental implants to work the way they are planned to work, the gum tissue and bone must be able to hold the tiny titanium posts that are used to secure the foundation for the artificial teeth.
In order to place an implant, you need a couple of things. You need adequate bone in a couple dimensions, adequate width of bone and adequate height of bone. The width is determined by how much room is between pretty much your cheek and your palate, or your cheek and your tongue. Is there enough width to place that implant? On top of that, you need enough height to place an implant. And that height is determined by how much room do you have between basically the top of the bone and certain vital structures that are underneath it. On the lower jaw, that's typically the nerve that gives you feeling to the front part of the lip and chin. On the upper jaw, that's typically either the floor of the nose or the floor of the sinus. If either of those don't have enough room, there's ways to get around that, but typically those are the two things we're looking at. An implant is usually a pretty benign procedure. A lot of people would ask, well, is it a really sore procedure afterwards? And the answer is resoundingly no. It's just not a real sore procedure, either during or after. I jokingly tell people that once I numb the area, typically the most uncomfortable part of the procedure is listening to me hum along to the radio. It's really not an uncomfortable procedure at all. Most people that have had an implant placed will tell you that it's usually a lot less uncomfortable than having the tooth extracted from a recovery standpoint. I do write people for some pain medicine in case they need it, but I'll tell you, I get a lot of people telling me, why'd you write me for 10 Vicodin and I needed 1? Or they just took ibuprofen or Tylenol or something over the counter. The upside to implants are, once an implant is placed, as long as you brush it and floss it and treat it like a regular tooth, it should last forever. And in this practice, I guarantee them forever. So something that has a 98% success rate should warrant a lifetime warranty. And that's kind of how we live up to it.
If you have any questions or interest in this option for a new look and feel inside your mouth, please contact our office.